Louise Aylman.
Mr Bailey, and I'd like to start by congratulating my honourable friend for securing this very important debate. I would like to draw attention to the crisis in social care which is currently taking place in Liverpool. And the background to that is that there are severe cuts on a city with a very low council tax base. 80% of Liverpool's properties are in council bands A and B, and cuts in government funding will come to 68% by 2020, resulting in a £90 million cut in the funding for adult social care. And the consequences up to now are a reduction in social care packages from 14,000 to 9,000. There are, of course, two aspects to social care. Domiciliary care, enabling people to live independently in their own homes, and social care related to people being able to be discharged from hospital. Both of those aspects are equally important. I certainly welcome the announcement of an additional £27 million for Liverpool over the next 3 years from the £2 billion additional allocation. And that is very important and has staved off an immediate crisis. But that money has been eaten up and will be eaten up by demographic changes, and for example, the increase in the numbers of people aged 65 and over will lead to an increase in costs of £8 million in next year, and the increase in funding required to implement the living wage means an additional £25 million extra is required by 2019-20. So welcome as that £27 million is, it will be eaten up by those increases. The situation is compounded by an error that was made by the Department of Communities and Local Government in assessing how much funding could be raised from Liverpool's council tax. I gather that error has now been rectified. That has confused the situation. Well, what do we need? Additional funding now is very welcome, but we need long-term, consistent funding related to need and more integration between the National Health Service and social care. I recognise the problems the chair of this select committee has identified, but a move towards integration is essential. Liverpool is innovative. Liverpool is already doing that, but it needs support from the government, both in terms of funding and general support to enable it to work constructively with the NHS, as it is already trying to do.